Hello guys, how are you doing? I am Dr. Himanshu Gupta and I have done my MBBS and MD from Unacademy Medical College and I am an educator at Unacademy. So guys, today in this short session, we are going to discuss few important spotters from the section of radiology. So let me begin with a motivational quote. It's not because things are difficult that we do not dare. It's because we do not dare things are difficult, right? So guys, getting a good rank, okay, is not difficult. It's just because we do not believe in ourselves that we can achieve that rank. We can give that much effort. Okay, that we think that getting a good rank is difficult. But guys, if we give the right effort, if if we are in the if we are following the right guidance, okay, nothing can guys stop us from getting a good rank in this NEET PG exam. Let's begin with the first part for today. Let's begin with the first part for today. Right. Okay. So guys, first of all, tell me what is the investigation? What is the investigation that you can see in this image? What is the investigation that you can see in this image? Anyone? Who will tell me? Very good, very good. So guys, the investigation that we can see in this image, it is your contrast enhanced CT scan of the chest. Contrast enhanced CT scan of the chest. So guys, how do we come to know? How do we come to know that this is a contrast enhanced CT scan of the chest? How do we come to know that this is a contrast enhanced CT scan of the chest? Who will tell me? Who will tell me? How do we come to know that this is the contrast enhanced CT scan of the chest, right? Okay, blood vessel has contrast in it. Very good dental cue. Okay. Besides blood vessel, what else? What else? What is the other structure that is having contrast within it? Besides blood vessel, what is the other structure that is having contrast within it? Besides blood vessel, what is the other structure that is having contrast in it here? Contrast within it. Very good dental cue. Okay, so this is what I wanted to know from you. This is what I wanted to know from you, that the other structure that is having contrast within it, it is your heart. It is your heart. Okay, so by just looking at the heart, you can also guess. You can also guess whether it is a contrast enhanced CT image or not. Okay, and the second structure are your vessels. Now guys tell me, what are your observations? What are your observations in this image? Now guys tell me, what are your observations? Observations in this image. Anyone? Come on guys, what are your observations in this image? Anything abnormality? And any abnormality that you can see? on this CECT chest image, any abnormality that you can see on this CECT chest image. So guys, I will tell you the abnormality that you can see in this image is you can see calcification along the pericardium. Okay, can you see this hyperdense calcification along the pericardium? Hyperdense calcification can be seen along the pericardium. So guys, this was a case of chronic calcific pericarditis, right? So moving on to the second case. Guys, what are your observations? Okay, first of all, tell me what is the investigation? What is the investigation that is being shown here? What is the investigation that is being shown here? The investigation that is being shown here in this image, is it a non-contrast image? A non-contrast image or a contrast enhanced CT image, or a contrast enhanced CT image? Anyone? NCCT. Okay. So dental Q is saying that this is a NCCT image. So what did we learn in the first quarter? Do you see any? So guys, in this image we can see that there is contrast. Within the heart and the great vessels. Okay, so guys, in this image we can see that there is contrast within the heart and the great vessels. Okay, so this is not a non-contrast image. But this is a contrast enhanced CT image. Okay, contrast enhanced CT image. Okay, this is a contrast enhanced CT image. Now guys, what are your observations in this image? In this image we can see is the audio and visual fine now? Okay, so guys, what is the investigation that is being shown to you in this image? Anyone? Okay, great. Okay, now tell me the investigation that is being shown to you guys in this image. So there must be some. So guys, in this image, okay, in this image we can see that this is a okay, very good, blurring of endomyometrial junction, right? And what else we can see? What else we can see? We can see that there are multiple, okay, multiple subcentimetric endometrial cysts that can be seen. Multiple subcentimetric endometrial cyst can be seen, right? Multiple subcentimetric endometrial cyst can be seen, okay, within the subendometrial region as well as your myometrium, within the subendometrial region and your myometrium, right? So guys, these are all important features. These are all important features of your. These all are important features of your adenomyosis of the uterus. Adenomyosis of the uterus. Very good, Shashti Katiyar. Very good, Shashti Katiyar. Okay. So this is another case. Okay. First of all, tell me investigation shown to you in this image. Investigation shown to you in this image. Anyone? What is the investigation that is being shown here? What is the investigation that is being shown here? Okay, so you are saying that this is a contrast enhanced CT image. Okay, so this is basically your lung window. This is basically your lung window. Okay, so we cannot comment about the contrast within this image. So we will just say that this is the CT image of the chest, okay, in the lung window. CT image of the chest in the lung window. We cannot comment whether it is a contrast enhanced or it is a non-contrast image. For that we have to have a mediastinal window, right? We need to have a mediastinal window, right? So guys, now talking about the observations. ठीक है? What is our observations in this image? What is our observations in this image? Anyone, guys? What is our observations in this image? What is our observations in this image? So guys, in this image we can see that there are few cystic areas within the lung. Okay, we can see few cystic areas, cystic masses within the right lung in the first image, and within the left lung in the second image. Okay, these are few cystic areas. So this was a case of congenital cystic adenomatoid malformation. Congenital cystic adenomatoid malformation of the lung, right? So guys, most of these patients, they will present with respiratory distress. Right? So and there are various types. Very good, Shashti Katiyar. There are various types of the congenital cystic adenomatoid malformation. So these include from type 1 to type 4. Okay, type 4. So just remember that there are various type, and type 1 is the most common. So type 1 you will have, okay, one or more cyst 2 to 10 centimeter in size, 2 to 10 centimeter in size. In type 2 you will have cyst less than 2 centimeter in diameter. In type 3 you will have cyst less than 5 in diameter. And in type 4, okay, in type 4, okay, in type 4 you will have an unlined cyst. In type 4 you will have an unlined cyst. Okay, so this is the classification. This is the classification for congenital cystic adenomatoid malformation. Congenital cystic adenomatoid malformation. Moving on to the next quarter, guys. Moving on to the next quarter. What do we see in this image? Okay, first of all, tell me what is being shown to you. What is being shown to you? So for NEET, you can just remember that type 1 is the most common type of CCAM. ठीक है? So tell me, guys, what are your observations in this case? Ankylosing spondylitis. Okay, great. So this is what I wanted to teach you in this image. This is what I wanted to teach you in this image. So guys, in this image we can see okay, is it fine now? So guys, this is what I wanted to show you in this image. That guys, in this image we can see that there is sclerosis along the iliac aspect. There is sclerosis along the iliac aspect of the bone. Okay, there is sclerosis along the iliac aspect of the SI joint, right? Of the SI joint. But if you look at the sacrum, okay, okay, the sacrum is normal in this case. And this sclerosis that you are seeing in this image, it is symmetrical. Okay, it is symmetrical, it is bilateral, and it is triangular in shape. Right? This sclerosis, it is symmetrical, bilateral, and triangular in shape. And if you look at the SI joint, SI joint is perfectly normal. Okay, there is no reduction in the joint space. Okay, there is no irregularity that you can see in this case. Okay, so this is not a case of sacroiliitis. Rather, this was a case of osteitis. Okay, this was a case of osteitis condensans ilii. Okay, ilii. Osteitis condensans ilii. Clear? Are we clear that this is a case of osteitis condensans ilii? Are we clear with this thing? This is the case of Osteitis condensans ilii, right? So guys, moving on to the next image, guys. What do you see in this image? First of all, tell me the investigation that is being shown to you. In this image. Anyone can. What is the investigation that is being shown to you? So guys, this is a contrast enhanced. If you just have a look at the vessels of the abdomen, this is a this is a contrast enhanced CT image of the this is a contrast enhanced CT image of the abdomen. Okay, CECT abdomen. This is a CECT abdomen image, right? Now guys, what is our observations? Where are these arrows pointing towards? Okay, where are these arrows pointing towards? Anyone, guys? So guys, these are pointing towards portal vein. Okay, portal vein. And guys, what we can see in this image, okay, that the portal vein, it is not enhancing. In a contrast enhanced CT abdomen, these portal vein, okay, this is not enhancing. This is not gallbladder. This is portal vein which is not enhancing. So guys, what is this case? So this was a case of thrombus formation. Thrombus formation within the portal vein and its branches. Thrombus formation within the portal vein and its branches. Okay. So so this was the region of portal vein. This was the region of portal vein. And guys, what happens? Okay, thrombus within the portal vein, it results in different attenuation of the liver. Okay, so there is thrombus within the right hepatic vein, right portal vein. Predominantly in the right portal vein there is the thrombus. So you can see that there is differential enhancement. There is differential enhancement of the right and left lobe of liver. Okay, can you appreciate that there is differential enhancement in the right and the left lobe of liver? How many of you guys can appreciate this thing, that there is differential enhancement of the right and left lobe of liver? Okay, there is differential enhancement within the right and the left lobe of liver. ठीक है, clear है? Is everyone clear with this thing? Is everyone clear? If not, please let me know. Moving on to the next image, guys. Moving on to the next image. Moving on to the next image, guys. What do we see in this image? This is a patient who presented with okay, this is a patient who presented with pain in the abdomen, pain in the abdomen, pain in the abdomen. Okay, and what is the investigation that is being shown to you? Investigation that is being shown to you. Very good start, Hatyar. Okay, so this is your central ciliate scar sign seen on contrast enhanced CT image by your focal nodular hyperplasia. Focal nodular hyperplasia. So guys, where else will you see this? Central ciliate scar sign is seen in Central ciliate scar sign is also seen in central ciliate scar sign is also seen in Can anyone tell me where else this central ciliate scar sign is seen in? Where else will you see this central ciliate scar sign? So guys, it is seen in fibrolamellar variant. Okay, fibrolamellar variant of HCC. Fibrolamellar variant of HCC. Okay, then it is seen in renal oncocytoma. It is seen in renal oncocytoma. Then it can also be seen in serous cyst adenoma of pancreas. Serous cyst adenoma of pancreas. Clear? Moving on to the next image, guys. Moving on to the next image. What do you see in this image? What do you see in this image? What do you see in this image? So guys, in this image we can see that there are various okay, non-enhancing cystic lesions can be seen in both lobes of liver. Non-enhancing cystic lesions can be seen in both lobes of liver, and along with that we can also see a central enhancing vessel. Okay, central enhancing vessel within that non-enhancing cystic lesion. Okay, so this is nothing. This is but your multiple. Okay, multiple choledochal cyst. This is nothing but your multiple intrahepatic choledochal cyst. Okay, multiple dilatations that are seen within the okay, multiple dilatations that are seen within the biliary system. Okay, within the biliary system, within the bile duct, right? So only intrahepatic system is being shown here. Only intrahepatic system is being involved here. So this was the case of Caroli's disease. Okay, so here let us also discuss the classification for Caroli's disease. Okay, the classification scheme that has been used for Caroli's disease, it is known as it was given by Tudani classification system is being used here. Okay, and guys, what is this type 1? What is type 1 choledochal cyst? What is type 1 choledochal cyst? Anyone? Type 1 is most common type. And what do you see? Okay, in this we can see that there is that there is dilatation of the extrahepatic bile duct. Okay, there is dilatation of the fusiform or saccular dilatation of the extrahepatic bile duct. In type 2 we can see that there is a diverticulum. That is arising from the common bile duct. In type 3 we can see that there is some dilatation. In the distal part of CBD. Some dilatation in the distal part of the CBD, and this is known as okay, this is known as dilatation of the CBD, okay, distal part of the CBD within the duodenal wall. This is also known as okay, choledococele. This is also known as choledococele, right? And talking about type 4A and 5B, 4A, 4B, 5, okay. So in type 4A, okay, there is dilatation of both. There is dilatation of both intra plus extrahepatic bile duct. In type 4B, there is dilatation of only extrahepatic bile duct. ठीक है, and in type 5, there is dilatation of only the intrahepatic bile duct. Dilatation of only the intrahepatic bile duct. ठीक है, and in type 6, there is in type 6 there is dilatation of the cystic duct. There is dilatation of the cystic duct, right? So guys, your observations in this case, so this is again okay. So liver and renal cyst. So this is not a cyst within the kidney. This is not a cyst within the kidney. Okay, so this is basically your hydronephrosis. This is hydronephrosis that is seen within the kidney. Hydronephrosis that is seen within the kidney, right? So okay, so now guys, we have to find out in this image what is the cause for this hydronephrosis. What is the cause for this hydronephrosis that you can see in this case? Cause for hydronephrosis that you guys can appreciate in this case. Anyone? So this is a tough question. So something is causing medial, okay, something is causing medial deviation of the ureter. Something is causing medial deviation of the ureter and is also resulting in blocking of the ureter So guys, this is a case of anyone. So guys, if you can see, what is this structure that is being shown in this image? What is this structure that is being shown here? This is your abdominal aorta. And around the abdominal aorta, guys, we can see there is some soft tissue density mass that is surrounding the aorta. Soft tissue density mass surrounding the aorta, and this was the case of retroperitoneal fibrosis. This was the case of retroperitoneal fibrosis. Retroperitoneal fibrosis. Are we clear? Are we clear? This is a case of retroperitoneal fibrosis. ठीक है? And this retroperitoneal fibrosis, it is also resulting in the medial deviation of the ureter along with obstruction, which is resulting in upstream dilatation of the left pelvic calyceal system. It is resulting in upstream dilatation of the pelvic calyceal system. Okay, very good. Also known as Ormond's disease. ठीक है, Ormond's disease. Okay, so just try to identify where is the carcinoid. ठीक है, mesenteric carcinoid. Okay. Okay. So let us see who is able to identify the abnormality. Within this image. Okay. So these are your MRI images. Okay, of the spine. MRI images of the spine, coronal and the axial images. What are your observations in this coronal and axial images of the spine? What are your observations in this coronal and axial images of the spine? बहुत ही अच्छे Srasti Gadiyar. Amazing answer. Okay, so guys, what can we see in this image? We can see two spinal cords. Okay, two spinal cords can be seen in this image. So this is a case of diastematomyelia. ठीक है? So just remember, that there are further types of the diastematomyelia. That is type 1 and type 2. Okay, so type 1 is there are two sacs which are separated by a common midline spur. Okay, two sacs which are separated by a common midline spur. ठीक है? And in the type 2, you have a single dural sac containing both the hemichords. Single dural sac containing both the hemichords. Okay, Okay, so moving on to the next image. Moving on to the next image, guys. What can we see in this image, guys? Anyone? What are your observations? First of all, tell me, what is the investigation? That is being shown? Okay, so guys, tell me, what is the investigation that is being shown? What is the investigation that is being shown to you in this image? seen, okay, which is seen in renal papillary necrosis. Renal papillary necrosis. So guys, what are the conditions? What are the conditions in which you are going to see? What are the conditions in which you are going to see renal papillary necrosis? Renal papillary necrosis. What are the conditions? Okay, so the conditions in which you are going to see renal papillary necrosis can be remembered with a simple mnemonic, that is your postcard. Okay, and this postcard stands for pyelonephritis, obstructive uropathy, sickle cell disease, tuberculosis, C for cirrhosis, A for analgesic abuse, R for renal vein thrombosis, D for diabetes mellitus, C for systemic vasculitis. Right? So the postcard stands for, let me just revise it for you again. It stands for pyelonephritis, obstructive uropathy, sickle cell disease, okay, tuberculosis, cirrhosis, analgesic abuse, renal vein thrombosis, diabetes mellitus, and your systemic vasculitis. Okay, so tell me the investigation. Tell me the investigation that is being shown here. Okay, investigation that is being shown here. An X-ray of the wrist is being shown to you. Tell me, what are your observations in this case? What are your observations in this case? Scaphoid unit dislocation. Okay, so what will happen in the scaphoid unit dislocation? You will see that there is increased distance between the scaphoid and the lunate bone. Okay, in scaphoid unit dislocation there will be increase in the distance between the scaphoid and the lunate bone. Okay, and that will give a Terry Thomas sign. Okay, very good. Okay, so in this image you can see that there is increase in the density of the lunate bone. And this is seen in this is seen in osteochondritis of the lunate bone. Okay, this is seen in osteochondritis of the lunate bone, and also known as Kienbock disease. Okay, osteochondritis of the lunate bone. It is also known as Kienbock disease. Right? Very good, Suyash. Banerjee. So tell me osteochondritis. Osteochondritis of the tibial tuberosity is known as. Osteochondritis of the tibial tuberosity is known as. Osteochondritis of the tibial tuberosity is known as. Very good. Osgood-Schindler's disease. Okay. Os the osteochondritis of the okay of the tibial tuberosity, it is known as Osgood-Schindler's disease. Okay, Osgood-Schindler's disease. And of the navicular bone, it is known as Collard's disease. Collard's disease. Of the calcaneum, okay, of the calcaneum, it is known as Sever's disease. Okay, Sever's disease. Okay, and osteochondritis of the central part of the vertebral body. Central part of the vertebral body. This is known as Shorman disease. Okay, Shorman disease. Shorman disease. Okay. So these are the various osteochondritis that you should know. So guys, tell me, investigation. What is the investigation? So one question will surely come on the investigation. Which investigation is being shown to you? Okay. Which investigation is being shown to you? Anyone? No, this is not intravenous pylorography. This is not intravenous pylorography. Okay. This is not intravenous pylorography. Anyone else who wants to make any guess what is the investigation that is being shown to you? No, this is not an MRI image. This is not an MRI image. This is not an MRI image. No, this is a barium swallow image. It is a barium swallow image. Okay, barium swallow image. What do you see on this barium swallow image? No, this is not retrograde pylorography. This is barium swallow image. This is your stomach. This is the stomach that is being shown here. Okay, this is a stomach that is being shown here. What are your observations in this barium swallow image? Barium swallow image. 6-month-old child, ठीक है, presented with vomiting, recurrent vomiting, ठीक है, recurrent vomiting. This is not right or left side. This is a lateral image. Can you appreciate? These are your vertebra. Stomach is on the left side only. This is your lateral image. Stomach is on the left side only. हाँ, बहुत ही अच्छे. So you can see that the stomach, it is over distended. Stomach is over distended, and you can see that there is narrowing. Okay, there is narrowing in the duodenum. Okay, second, there is narrowing in the pylorus as well as duodenum. Okay, narrowing in the pylorus as well as duodenum. Okay, so you can see very thin streak of contrast. Thin streak of contrast can be seen within the duodenum and the pyloric region of the stomach. ठीक है. So what is happening? What is happening? What is the criteria for a child to label it as congenital hypertrophic pyloric stenosis? Okay, the thickness of the pylorum should be more than 4 mm. The thickness of the walls should be more than 4 mm, and it should extend for a length of 16 mm. It should extend for a length of 16 mm, right? It should extend for a length of 16 mm. ठीक है. Identify the investigation shown here. Investigation shown here. No, this is not digital subtraction angiography. This is not digital subtraction angiography. This is an ERCP image. ERCP image. What you can see? You can see right and left hepatic duct. You can see right and left hepatic ducts. You can see right and left hepatic ducts in this case. ठीक है. And within the hepatic duct you can see various strictures. Okay, various stricture formation within the right and left hepatic duct. Stricture formation within the right and left hepatic duct. ठीक है. Seen in a case with primary sclerosing cholangitis. Seen in a case with primary sclerosing cholangitis. ठीक है. These are your MRCP images. This is your ERCP image. ठीक है. ERCP image. ठीक है. What do you see? What do you see in these images? What do you see in these images? ठीक है. First of all, tell me your observations, and then we will make the diagnosis. What are your observations? And after that, we will make a diagnosis. Choledocholithiasis. No, this is not a case of choledocholithiasis. This is not a case of choledocholithiasis. अब बताइए other findings. What are the other observations? What are the other observations? What are the other observations that you can see in this image? Suyas Bagri. What are the other observations? Shasti Katyar. Very good. Okay, so you can see that your bile duct and your intrahepatic biliary system, it is dilated. Okay, intrahepatic biliary radicals, they are dilated. Okay, your common bile duct, it is dilated. ठीक है. This is one of the observation. Very good, very good. Okay. Can you make a diagnosis now, Srashti Katiyar? I have simplified the image, ERCP image for you. I have simplified the ERCP image for you. Can you make a diagnosis now? Yes, there is some filling defect. I'm I'm not. I just ruled out. I just ruled out that there is no choledocholitis. ठीक है? There is filling defect. Okay, there are filling defects. Filling defects. Okay, so now you have to come with an answer for me. Now you have to come with an answer for me. So you will enjoy once you yourself come to an answer. Okay. So I will give you some time. I have shown you the filling defects. Okay. Now tell me. Now tell me. What is the problem? What is the problem? So in periampullary carcinoma, okay, you will also see that your pancreatic duct. I will show you pancreatic duct also. If I have to show you a periampullary carcinoma, I will show you dilated pancreatic duct. Okay, I will not show you filling defects. Filling defects will not be seen. Okay, like that of calculi. Anyone? What is this? What is this structure? What is this structure? Can you help me label the structure A? Can you help me label the structure A? Very good. Very good. What is the structure labeled as B? Structure labeled as B in this image. Shrashti, Katiyar and Swesh Bagri. Very good. B is cystic duct. So now can you tell me where is this calculus seen? Where is this calculus seen? बहुत ही अच्छे, बहुत ही अच्छे. Very good answer. Very good answer. Okay. So there is some calculus within the cystic duct, and that is impacting onto the common bile duct, resulting in the dilatation of the common bile duct and the intrahepatic biliary radicals, resulting in the dilatation of the intrahepatic biliary radicals, and this is what is known as Mirizzi syndrome. This is what is known as Mirizzi syndrome. Clear? This is what is known as Mirizzi syndrome. Mirizzi syndrome. ठीक है? Okay. Now, guys, coming to the next part. What do you see? What do you see in this image? This is a contrast enhanced CT image of the neck. Contrast enhanced CT image of the neck. What are your observations in this? Okay, let me zoom it for you. Anyone? Okay, tell me where are you seeing the abnormality? Okay, which which part you are seeing the abnormality? Which part you are seeing the abnormality? Left muscle anteriorly. Very good observation. Okay, Srashti, tell me, is this muscle or is this something else? Okay, is this a muscle or is this something else? Is this muscle or is this something else? Okay, try to identify this structure. First, tell me what is this structure. ये कौन सा structure होगा? ठीक है? Identify this structure first, and what is lying anterior to this structure? What is lying anterior to this structure? What is lying anterior to this structure? Okay, this structure is your thyroid cartilage. Okay, thyroid cartilage, and this is your thyroid gland. This is your thyroid gland. ठीक है? And guys, what can you see in this thyroid gland? What can you see in this thyroid gland? This is your thyroid gland. Okay, you can see a non-enhancing cystic structure, non-enhancing cystic structure within the thyroid gland. Non-enhancing cystic structure within the thyroid gland. ठीक है? Non-enhancing cystic structure within the thyroid gland. Okay, so this was a case of not tumor. Okay, the most common location for this lesion is your subhyoid location. ठीक है? This was a case of thyroglossal cyst. Yes, it can calcify. Very good. ठीक है? So you can see the Wimberger ring sign. ठीक है? And Wimberger ring sign, very good. Pencil thin cortex, then Trummerfield zone of rarefaction, then all these things, these are seen in scurvy due to vitamin C deficiency. Okay. So you just have to identify where all you can identify the lesions. Okay, in this case the lesions are seen in where? Okay, where will you see the lesions in these cases? Where are you going to find the lesions in this case? Okay, this is pancreas. This is the lesion is not there within the pancreas. Okay, the lesion is not there within the pancreas. No. Any other guesses? Any other guesses? Okay, very good, very good. Okay, very good, Shashtikat yaar. Okay, so one lesion you can see within the stomach. Okay, within the stomach that, and you can also see few non-enhancing areas within the stomach, and the another lesion that you can see is in the left lobe of liver. Okay, left lobe of liver, left lobe of liver. Okay, so this was a case of metastasis. Okay, metastasis in the left lobe of liver along with just within the stomach, gastrointestinal stromal tumor within the stomach, right? Beta thalassemia, beta thalassemia. Okay. Hair on end appearance seen in patient with beta thalassemia, right? So, okay. So guys, before I end this session, so let me tell you few important things about the Unacademy platform. Okay, so guys, we are introducing we are introducing notes for the NEET PG. Okay, so these notes, guys, these are available for all the 19 subjects, right? So you can use our notes to boost up your preparation. So guys, we have a plus subscription. Okay, so where you guys will get an advantage to enroll for our batch courses. Okay, so we have the batches which are running for various exams. Okay, for NEET PG 2022 we have a separate batch. For next exam, for FMG exam, we have different batches that are running. Okay, in these batch courses, you know, the classes are taken, all the all the subjects are covered in a very systematic manner, and we give a lot of grand test discussion will take place. And guys, the best advantage is that you will get to do these classes, okay, live, as well as you can do it in recorded form. Okay, and you can ask your doubts, you can directly engage with the educator through the raise a hand feature. And what is this raise a hand feature? We can directly ask our doubts with the educator who is teaching, uh, and this is the basic advantage, this is the main advantage that you are going to get in a live class. Okay, so your doubts, okay, doubts will be very easily cleared in your live class, and uh, you can study at home, study at whatever place you are in, and listen to these live and the recorded classes. So as you can see, today's live class, okay, you you got this opportunity to attend it live. Okay, all those who got this opportunity to attend it live, okay, you guys were able to clear your doubts, you guys were able to think with me, and this is what happens in a live class, right? So we have this iconic subscription also, in which you can take both Unacademy and Prep Ladder, Unacademy and Prep Ladder, right? So these are the various special class features. So the batches which I was talking about, okay, these are the various batches. Okay, that is your NEET PG 2022 batch. Okay, previous year questions batch that will start from 2nd of March to 2nd of May, Then we have a FMGE batch, focus FMG batch that will start from the 2nd of March. Okay, and this is an FMG batch, okay, for comprehensive batch in which everything will be covered in a very comprehensive manner. So you can enroll for these batches if you are preparing for this FMG exam. Okay. So guys, this was all for today. I hope you enjoyed this session, right? And we will meet again at 10 p.m. tomorrow on the Unacademy NEET PG YouTube channel with few more discussion on the spotters in radiology, right? So thank you guys. Bye bye. Take care. Keep working.